Vincent Omondi is a worried man.
Sasa ile kitu imefanya mimi niko na uoga. Sina kazi, kuna mahali mimi nafanya kazi. Kazi nafanya ni ya mjengo na dakika moja ukifanya leo kesha hakuna. Sasa kama hii dawa ni vile nasikia mambo yake inaendelea ikiyumba. Hii sasa imeanza kupatia sisi uoga ya maisha.
It is not just his life that he's worried about, but also that of 7 of his 8 children. You see, the events of 15 years ago when he was diagnosed with HIV are still fresh in his mind.
Unajua si kujua kama niko na ugonjwa na kuna sijui naitwa namna gani mwenye anakupatia mawaidha. Sasa hii mguu sikuwa natembea, nilikuwa natembea sasa na scratches. Sasa akakuja nikapimwa. Vile nilipimwa nilipatikana niko na TB. Sasa baada ya kupimwa niko na TB, nilishangaa hii TB mimi sikunywa sigara, mbona imenishika. Baada ya kupimwa na TB nilianza vile naweza meza dawa ya TB. Sasa tulikuwa na mshiriano kama hiyo. Ile anakueleza kitu ile inakufanya. Akaniambia vile umetoka kwa TB, wacha upimwe kama uko na HIV. Sasa nikauliza hao HIV inamaanisha nini? Akaniambia. Sasa kulikuwa na msichana mwingine hapa, akaniambia kubali tu. Nilikubali, nikaenda nikapimwa, nikapatikana tena hiyo iko kwa mwili.
Omondi, an untrained mason and painter living in Soweto in Kibra, was devastated. But with counseling from Ushirika Medical Clinic in Kibra, he was able to convince his wife to be tested as well.
Nilikuja naye mpaka hapa. Nikapelekea yeye mshauri. Sasa mshauri akamweleza, hii bwana yako amepatikana na TB, at the same time amepatikana na hii ugonjwa kubwa. Bibi alianza kulia. Hii ugonjwa tumetoa wapi?
Omondi would later on find out that his children were equally affected. His next concern was how to get drugs for his entire family living with HIV while he was jobless.
Sasa nikauliza, sasa hii na vile mimi sina kibarua, sina kazi, uwezekano itakuwa namna gani jinsi naweza kuwa mzima? Wakatuambia kwa hapa hiyo tutakupatia bure.
With the recent freeze on foreign aid by the United States government, the effects of HIV programs in the country will be profound. This will mean that access to HIV drugs by people living with HIV like Omondi and his family will be difficult.
It has been like normal to receive this aid. So if all of it is suddenly cut, definitely there is going to be a very big gap, and it is going to hit hard on the people who have been receiving these services. Whether they are the clients who have been using the drugs, they will be hit. Right now, it may not be felt because facilities had a stock that may have run for about 3 months or some 6 months. But if it goes beyond that period, without this stock being replenished, definitely we are going to have a crisis, and a big crisis at that.
A quick scan through the online HIV drug inventory, the commodities dashboard managed by the National AIDS and STIs Control Program, NASCOP, shows that the drugs are available. While the different drugs have varying levels of availability in the facilities and in the central stores at the Kenya Medical Supplies Agency, KEMSA, Dr. Ruth Laibon Masha, the head of the National Syndemic Diseases Control Council, insists that there is no cause for alarm.
Currently, in terms of most of the drugs, we don't have any kind of a challenge right now. We have enough stocks that, if you look at the entire supply chain that we have currently. And then it is not only the PEPFAR money that was given us, or the drugs. So some of those commodities are available from different other pockets.
So this was largely a PowerPoint presentation by a government official, but what gives us reassurance at the moment is that no one has spoken of stockouts of antiretroviral drugs. There have been conversations about stockouts of TB drugs, which I think is being addressed by civil society in various levels. but we haven't had any communication from people living with HIV to say, I've gone to the clinic and I'm missing out on my drugs. And so I think for us, that's a good indicator, because the moment there's a signal that someone is either getting less medicine or someone is not getting medicine at all, then we know definitely there's a break in the supply chain for the ARV. So that is what gives us reassurance for now, but we've not seen any written documents or seen warehouse records from KEMSA. We have to take the word of the government official who spoke to us to be the truth until proved otherwise.
At the heart of this current challenge, however, is the country's overdependence on aid to fund its HIV programs. According to Maleche, the country needs to wean itself of this dependence.
However, in the case of Kenya, it's the reverse. We have relied heavily on the donors, and then the other sectors are then supplementing this, which means we have a dependency syndrome. We are fully dependent on donors for our ARVs, for our TB drugs, for our malaria tests, and even for treating people for co-infections. And so that is a very dangerous trend for us, and so there needs to be efforts by both the national and county government to come up with sustainability roadmaps that talk about how do they plan to transition from being donor dependent to being independent in the provision of healthcare services, particularly provision of HIV services.
In the face of this uncertain future for access to HIV drugs and sustainability of HIV programs, Dr. Masha says that the government has a plan.
If you ask me if we are ready as a country, I think the one thing we have is opportunities. First of all, we are lucky as a country. We have a supplier here who does local manufacturing for one drug that is critical for us, Universal. They do manufacturing of one of the first-line drugs. So one of the opportunity we have is to look at how do we partner now with the private sector to think about our own local manufacturing, because that now reduces our lead time and it ensures that we can now purchase in portions. The second area is that looking at the amount of fund money that is available across the country. And one of them is the infrastructure. There is a legal, there's in the law, there is an opportunity there to fast track how we use that money, especially in the industry sector, where we know that for every new project that happens, at least 1% should be spent on HIV. So we may want to think about consolidating that money together. Rather than passing it to the contractor, then the contractor to pass it to somebody else, we want to look at how do we pull it back and then use that money to use as a reserve for procuring those commodities. So then thirdly, of course, is to go back to exchequer, which, as you said, that the government have enough money. Governments cannot have enough money. What governments have is priorities. And this is a priority.
For now, Omondi, knowing too well the consequences that may come with skipping his drugs, can only plead with the government to ensure that the drugs are available.
Sasa tulikuwa naomba serikali ama wale wanaweza husika na hii jambo, tuangalie ni kitu gani tunaweza fanya ili tusikose dawa, sababu watu wengi wanaenda kukufa.
The NASCOP data show that all the 47 counties have over 3 months of stock of HIV drugs at the facility level. At the central stores, however, there are drugs that are not in stock, while others have up to 38 months worth of stock. Anthony Langat for Willow Health Media.